After 120 years, aspirin is in excellent health. What are the pros and cons of this drug?
Well, aspirin is very effective in preventing atherothrombotic events, both in the coronary and cerebrovascular territory. There were presentations yesterday emphasizing a remarkable impact of aspirin in the early phase of stroke, for example, with very substantial benefits in reducing stroke recurrence and stroke disability. This is obviously extended to the coronary territory with very substantial evidence that aspirin, low-dose aspirin, prevents further coronary events and reduces mortality in the acute phase of myocardial infarction. And in addition, there is recent evidence that aspirin may be protective against some forms of cancer, in particular cancer of the gastrointestinal tract, and in particular cancer of the colon rectum. The cons, the downside, the side effects are related to exactly the same mechanism of action that explains the protective effects, that is the antiplatelet effect, which will impair the physiological process of primary hemostasis and therefore cause increased bleeding. This usually occurs in the upper gastrointestinal tract, but can also occur in the brain. And the balance between the benefits and risks of aspirin administration depend on the individual characteristics of the patient. There is a clear positive balance in so-called secondary prevention, the treatment of high-risk patients for the secondary prevention of new major vascular events. There is a clear benefit to risk ratio in the acute treatment of coronary syndromes or TIA or ischemic stroke. The uncertain balance is in so-called primary prevention in relatively low-risk individuals. And here, it depends what you put on the side of the benefits. If you put together the cardiovascular benefit plus protection against colorectal cancer, then this benefit will substantially outweigh the excess of bleeding complications. If you only put the cardiovascular benefit, the balance between the two is substantially uncertain.